Hello, nurses. This is Lisa, and we have a presentation today about legal principles of nursing and then nursing ethics. So, our podcast today objectives are discuss the accountability and responsibilities of the professional nurse in upholding the legal scope of nursing practice, which includes the Nurse Practice Act of Michigan, the American Nurse Association Scope and Standards of Practice. Examine the role of ethics in professional nursing practice using the American Nurse Association Code of Ethics. Describe the process for recognizing and resolving ethical dilemmas. Discuss the legal and ethical responsibilities of the professional nurse as an advocate. So, one of the things that before we get into terminology and law is that it's important to recognize that our legal system and our ethics are based on values. And we've talked before about different issues in nursing and how it really helps to evaluate your own feelings about issues, and this is another one of those places where that can be important so that you have an idea of where you're coming from, and that can help you dealing with other issues. And we know that in healthcare, we come across those issues fairly frequently. So some places where we get information about legal information for nurses. The first are the sources of law. Where does it come from? And one of those would be common laws, and those are based on judicial decisions in the past, or what we call case law or precedent. So one example of that would be Roe v. Wade, in which the U.S. Supreme Court identified when termination of pregnancy is legal. And then there are statutory laws, which are laws that are passed by the legislature. And one example of that would be HIPAA. Would the confidentiality and billing rules that go through HIPAA are considered statutory laws. There is a difference between criminal law and civil law. And criminal law are say that a crime is an action that inflicts or threatens harm to individuals or to the public interest. And a misdemeanor is a crime that does not inflict serious harm and usually has a penalty of a monetary fine, some type of forfeiture, or brief imprisonment less than a year. A felony is a serious offense that results in significant harm to another person or to society in general and carries penalties of monetary restitution, imprisonment for greater than 1 year, or even up to death in some states. Examples of Nurse Practice Act violations that may carry criminal penalties include practicing nursing without a license or misuse of controlled substances. Torts are civil wrongful acts or omissions against a person or a person's property. So the difference again between criminal and torts or civil wrongful acts. Criminal is that there has been an action that has inflicted or threatened substantial harm to individuals or public. Torts were against one person or a person's property, and they are often compensated by awarding money to the individual whose rights have been violated. Intentional torts are deliberate acts of wrongful conduct. So an example of that would be assault and battery. So assault and battery can be considered a criminal violation, but it also can be called a tort, considered a tort in healthcare. So please know the difference between assault and battery. Assault is an intentional threat toward another person that places the person in reasonable fear of harmful, imminent, or unwelcome contact. No actual contact is required for assault to occur. An example of assault in nursing practice is to threaten to restrain a patient for an X-ray procedure if the patient has refused consent. So assault is a threat. Battery is the intentional offensive touch without consent or lawful justification. Touching may be harmful to the patient by causing an injury, or it may be merely offensive to the patient's dignity. An example of battery in healthcare is when a patient has consented to right knee surgery, but the surgeon performs the surgery on the patient's left knee. Unintentional torts, an example of that would be negligence, and that is conduct that falls below the generally accepted standard of care of a reasonably prudent person. So if you think about negligence in healthcare, we need to know a reasonably accepted standard of care of a reasonably prudent person. That standard of care could be different for a physician, for a PA, for a nurse assistant. And so negligence could be a little bit different between those professions because their accepted standards of care are different. Malpractice is more of an egregious negligence by a professional. So if it's something that the nurse should have done and it didn't get done, then it could be considered malpractice. And we do need 4 elements for an act to be considered malpractice. The first is that the nurse owed a duty to the patient. The second is that the nurse breached the duty. He or she did not complete the duty. The patient was injured because of the nurse's breach of duty. And last, the patient has accrued damage as a result of the injury that was a result of the breach of duty. If any one of those 4 elements is missing, there is no malpractice. I do want to mention here that patients have the right to self-determination, and that is part of our common and statutory laws that are made by the government. So here's an example. I'll go ahead and read the slide. You are in your final clinical rotation of nursing school. The clinical instructor assigns each student to 2 patients. Although you accept your assignment, you feel uneasy about providing care for 2 patients, especially since both have congestive heart failure. You are extremely cautious as you check the prescribed medications in your reference book, check the medications with the staff nurse, and administer the doses. To save time, you take both patients' medications into the room and check each patient's name band. You document every nursing action, including the education on medications given to the patients. When the instructor asks how things are going, you feel confident in stating you are handling 2 patients very well. You further explain how you took the initiative to educate one of your patients on the side effects of a new blood pressure pill when the patient stated he never took that medication before. The instructor asks to see the order for the drug, but when you look for the physician's order, you are unable to find it. You suddenly realize that you switched the patient's medications and wrongly dosed both patients. Later in the shift, one patient's blood pressure drops to the point of requiring a transfer to ICU, and the other goes into renal failure requiring dialysis. Who is liable for the actions of the student nurse? You, because you gave the medications, the staff nurse who checked the medications, or the instructor who was supervising? And the answer to that is the student nurse retains liability because as a student, the student nurse is held to the standard of a registered nurse, and both patients should not have been medicated at the same time. Did the instructor meet the standards for supervisory liability? The instructor gave a proper assignment, yes. An adequate supervision, the instructor was available if needed, yes. And was appropriate follow-up and evaluation completed? Yes, it was. Now suppose you had requested supervision for the medication administration, but could not find your instructor. Who would be liable in this case and why? Then it would be the clinical instructor because the supervision was requested but not available for the student. Torts are civil wrongful acts or omissions against a person or person's property. So if you think about what happened here, this would be considered, it could be considered a tort. If we look at those 4 elements of malpractice, the nurse owed a duty to the patient, which the nurse did because it was time to pass medications, and that's part of the responsibility of a professional nurse. The nurse breached the duty, and the nurse did do that because they gave the wrong medications to the wrong patient. And there was no, you should never do that. Take 2 patients' medications in at the same time. That's just a big no-no. The patient was injured because of the breach of duty. And we have 1 patient who went to ICU and 1 who required dialysis. So there's your injury as well as damage. So we're not sure of the long-term damage, but either one of those patients could likely have long-term damage. When it comes to having insurance, there is insurance available for student nurses and nurses, malpractice insurance. And the employer will usually provide some type of insurance over their employees. Some people recommend to get additional coverage. Some recommend not to. I think it depends on what's going on in your life and what you have and what you don't have. And so another gray area, but that usually is available at a fairly low cost for students if you're ever interested in looking into that. So when we look at standards of care, remember these are legal guidelines for minimally safe and adequate nursing practice. Nurse Practice Acts are examples of statutes enacted by state legislatures to regulate the practice of nursing. It defines the scope of practice, so what nurses can do and what they can't do. Expanded nursing roles, so for example, DNPs or nurse practitioners. It sets educational requirements, distinguishes between nursing practice and medical practice, establishes a regulatory agency such as the State Board of Nursing, and in Michigan we have a public health code, which uses principles of administrative law to guide the regulation of nursing practice. This agency has the power to suspend or revoke a nurse's license if the nurse's conduct violates provisions of the licensing statute. There can be criminal law violations, even if unrelated to nursing, that can jeopardize your license status. Michigan's Nurse Practice Act is not quite specific. There is a link to the Nurse Practice Act in the notes, and you should take a look at that. There are some state and federal hospital licensing laws and accreditation rules, which are based on recommendations from the Joint Commission. Professional and specialty organizations can also create scope and standards of practice, like the American Nurse Association, and those often are used by the state boards of nursing. There are also written policies and procedures of healthcare facilities that we follow. And so it's important to know at your facility what the nursing scope of practice and scope of practice is expected to be, and the policies and procedures because there will be standards of care to which your actions will be compared if you are in a trial. So, for example, if you are, something happens and the nurse was not following the policy and procedure created by the facility, that could be just some evidence against the nurse. It's important to be up to date regarding your facility's policy and procedures and state and federal laws, current legal issues, and any new rules, regulation, or case law that will affect your nursing practice. There's not, as far as I know, I could be wrong, one specific place to go and look for all that information. I would say the State Department of Nursing is pretty good about notifying if there's a change in licensing requirements, continuing education, things like that. In the state of Michigan, I'm not sure about how it works in other states. So briefly going over the American Nurse Association scope and standards of practice, the first 6 are really the nursing process. And I'm going to switch screens here because I actually have them called up. And so these are the first few standards of practice for all registered nurses. So assessment, diagnosis, nursing diagnosis, outcomes identification, planning, implementation. Part of that is coordination of care. And so remember that nurses are the one specialty that knows what everybody else is doing. Health teaching and health promotion, consultation as needed, prescriptive authority and treatment. So that's for advanced practice nurses like nurse practitioners, DNPs, and then evaluation. So we really see those first 6 standards as the nursing process. And then if we go back and look at the following 7 through 16, these are covered very briefly in our associate degree nurse program at MID and at really all ADN programs. They are covered more fully when you continue on for your BSN, and you'll get more certainly in here for these final scopes and standards. So I want you to be aware of that. You can look that up on the internet, and I just want you to be familiar. I know we are already familiar with the nursing process, but if you think of it as a scope of practice, that makes us look at it a little bit differently. I'm going to switch topics a little bit, and I want to make sure that you do watch this video that's linked in your presentation from Moodle and talk about professional boundaries. Sometimes we can get a little bit too involved with our patients and with or families, and we want to make sure that we are maintaining a professional relationship and a therapeutic relationship with our patients, and not getting too close to our patients, and just remembering that we are there with our patients for a reason. So I'll let you watch that video on your own. So when it comes to risk management and quality and assurance, this is mandated by the Joint Commission. And it is necessary to document the nursing process and to develop a caring rapport with each patient to avoid liability. Our assessments and the reporting of significant changes in the assessments are very important factors in defending a lawsuit. Your documentation of your nursing care is your only record of what was actually done for a patient and will serve as proof that you acted reasonably, safely, and professionally. Please make sure that your documentation is thorough, accurate, as well as timely. Remember, if it is not documented, it is not done. Incident reports. When there is a deviation from the standard of care or an error is made, you document the event or incident in the form of an occurrence report or an incident report. We have talked about this before, but please do not document the nurse's notes that an incident report was completed. It has been my experience that incident reports are handled with care and definitely not as with punitive measures. So I feel like you should never be afraid to fill out one of those reports. Risk management and quality improvement. The Joint Commission has a mandated system of ensuring appropriate nursing care that attempts to identify potential hazards and eliminate them before harm occurs. So they look at possible risks, they analyze those possible risks, and act to reduce them, and then they evaluate the steps that are taken. Patient safety and improved care are the ultimate goals of risk management and quality assurance. Never events are preventable errors, which may include falls, urinary tract infections from improper use of catheters, and pressure ulcers. A sentinel event could be a wrong site surgery, also considered a never event. Rapid improvement event. A rapid improvement event is very similar to risk management or quality assurance. However, those projects typically take can take months, even up to a year or more to implement. When you have a rapid improvement event, that's something where they put a small team on to study, look at some statistics, look at ways to fix it, and implement those in a very short period of time, over a period of days to a week, and start with a small group before rolling it out to a whole facility or group of people, and meant to make some small changes quickly rather than some big changes over a long period of time. And then we have Good Samaritan laws, which really help us when we're deciding to help somebody out in the community. So, for example, you're driving along, you witness an accident, you stop your car, you get out, and you help the people in the accident. You are not acting as a nurse. You are not acting as a professional nurse in that scenario. You're acting as a human being, and whatever happens, you are held to the standard of any other human being on the road because when you stop for that accident. Now, if that accident victim is brought into the emergency room and you are the emergency room nurse, then you are expected to operate under your professional nurse expectations. So here's another case. Let's look at this. While you are at your son's baseball game, one of the other players slides into second base and then lies there without moving. Another player yells for help. The other parents know you are a nurse and ask you to check the player while they call 911. When you approach the child, you note his leg is fractured and lying in an awkward position. You feel that if you reposition the leg, you might cause more harm and pain for the child. You assess the leg and note it is warm with palpable pedal pulses. You provide care to ensure he does not go into shock until the ambulance arrives. Attempts to reach the child's parents are unsuccessful. Upon arrival to the hospital, the ER nurse assessment now indicates impaired circulation and sensation in the extremity and does not alert the physician because of the unsuccessful attempt to reach parents. 3 months after the incident, both nurses receive word they are being sued for malpractice because they did not provide interventions to ensure the safety of the leg. The child is undergoing extensive physical therapy related to neuromuscular damage. Does this scenario meet the basic elements of malpractice for the bystander? Explain. No, you do not have a professional nurse-patient relationship in this case because you were attending the event as a spectator, not in the role of the nurse. In this scenario, you had no duty to that child, and this would fall under the Good Samaritan law. So next topic is consent, and this is a big topic in healthcare. General consent is required for healthcare, any healthcare treatment or procedures. And on your screen, you can see that adults who are 18 plus years of age or the parent of a minor, so if you have a 16 or 17-year-old parent, they can give permission up for themselves or their child. A guardian or a ward, adult sibling of a minor can give consent. A grandparent of a minor grandchild, if in an emergency and the parents are not present, can give consent. People who are considered minors, who can give consent, would be a child in some type of legal custody, and that's a little bit nitpicky how that works. If they can give consent for themselves, if they are legally married or they are emancipated. If the minor is pregnant, she can give consent. I know it says venereal disease. It's still explained that way in the law, so it's why I put it there. But so any sexually transmitted infections can be treated with just the minor and no parent consent, or for any drug or substance abuse. There are consent forms. Usually each facility has their own form. If you have a patient who has hearing issues or sight issues, if the patient is illiterate or speaks a foreign language, as the nurse, you need to take steps to ensure that the patient understands the document they are signing. It is also important to be sensitive to cultural issues of consent and to understand the way in which patients and their families communicate to make important decisions. Informed consent is a person's agreement to allow something to happen, such as surgery or an invasive procedure, based on full disclosure of risks, benefits, alternatives, and consequences of refusal. Responsibility of the healthcare provider performing the procedure, that is the person responsible for getting the informed consent, not the nurse. So if the patient is asking questions or you feel they are not understanding those pieces, the risks, benefits, alternatives, or consequences of refusal, you call the provider, and that person needs to come and talk to the patient. Patients have a right to refuse. In an emergency situation, healthcare providers may provide care to patients without consent as long as it is presumed that a reasonable person would have agreed to do the same or similar. If the person is unconscious, it is best to obtain consent from a person legally authorized to give consent on the patient's behalf. That could be a spouse or a parent. If somebody is legally incompetent, then you need to have their legal guardian give consent. People who are mentally ill, it has to be determined for a situation to be dangerous to do something without the consent of that patient. Living will or advance directive. Living wills are documents instructing the healthcare provider to withhold or withdraw life-sustaining procedures in patients who are terminally ill. If a patient has executed a durable power of attorney for healthcare, the document will designate an individual, also known as a healthcare proxy, who is able to give consent for healthcare treatment when the patient is no longer able to do so. If the healthcare provider has documented in progress notes that a patient is deteriorating and the healthcare provider and the patient have made the decision not to administer CPR, the healthcare provider should write a do not resuscitate order. It needs to be written and cannot be given verbally. If we are dealing with issues of organ donation, it is required to have a signed consent before donating a patient's organs or any tissues. In some states, you can use that check on your license, driver's license, but in most states, you need to have a family member sign at the time of death. When it comes to confidentiality, it is protected by patient confidentiality is protected by statutory law. Patient confidentiality is the right of all patients, and it is a privilege that a patient entrusts you with his or her personal health information. A professional nurse has an obligation to report breaches of privacy and confidentiality. Next topic, we're going to go off topic a little bit here. Same vein as confidentiality, and that is social media. Social media and healthcare do not mix. Please do not post, "Oh, I had a terrible day at work today." Anything about any patient. I don't care if you mention a name or not, no name. We live in a small town and word gets around. Please do not post anything about work on any social media. When it comes to provider orders, there can be some instances with legal issues regarding orders. And this is why you always need to cover yourself, that you give proper SBAR to providers, that you read back. The nurse has an obligation to question an order if you're not sure. There is now texting to be allowed, although I'm not sure if all of our facilities are doing this yet. And the Joint Commission says that's okay as long as it is secure, that there's some way to know who sent the note, the text, and who received it, that there's a timestamp, and just really like a specified list for people who can give and receive those orders through text. Patient abandonment issues. You will encounter inadequate staffing during times of nursing shortages and staff downsizing periods when agencies seek to achieve cost containment. Liability issues exist if a healthcare facility does not have enough registered nurses to provide competent and safe care, and if a patient is injured as a result of negligent care by any personnel. If you are assigned to care for more patients than is reasonable for safe care, notify your nursing supervisor. If you are required to accept the assignment, document this information in writing and provide the document to nursing administrators and keep a copy of the document yourself. Do not walk out when staffing is inadequate because this act could be regarded as patient abandonment. There are times when nurses are asked to float from the area in which they normally practice to other nursing units. If you float, inform your supervisor if you lack experience in caring for the types of patients on the new nursing unit. The rights of delegation. Please remember the right task, right circumstances, the right person, the right directions, and the right supervision. I want to talk about substance abuse in health for healthcare professionals. So I mentioned earlier in this podcast that there are criminal laws for when healthcare workers are misusing substances in their workplace, and it could be a misdemeanor or a felony. Examples of the Nurse Practice Act violations that may carry criminal penalties include the misuse of controlled substances. There is what's called, in the state of Michigan, a Comprehensive Drug Abuse Prevention and Control Act that was passed to control and regulate hospital drug distribution systems of narcotics, antidepressants, hypnotics, sedatives, stimulants, and hallucinogens. And those will be counted between every shift at every facility. You may only administer those substances under the directions of a licensed physician who is allowed to prescribe those substances. All controlled substances are securely locked away, and only authorized personnel have access. So part of your role is to keep those locked up. You are also to maintain precise records regarding dispensing, wasting, and storage of the substances. There have been cases in which physicians have illegally prescribed and dispensed controlled substances. If you are employed by such a physician and fail to report these activities, you are legally accountable for aiding and abetting that physician. In the state of Michigan, healthcare professionals who have an addiction can go through the Health Professional Recovery Program, and there's a link to that in the notes. And it is a really great program for healthcare workers who need that, and it allows them to keep their license while following some pretty specific parameters. Reporting obligations. We are mandatory reporters, and we, among a few, we actually have quite a long list, and there's a link to the list for the state of Michigan in the notes of this slide. But the things that we might see most often would be abuse, any type of abuse, rape, gunshot wounds, attempted suicide, certain communicable diseases, and you'll find those on the list, unsafe or impaired professionals. So if you are working with a nurse who is an alcoholic and smells of alcohol or drinks on the job, you are required to report that. Okay, so moving into Chapter 6, Ethics. This chapter describes some tools that you can use to embrace the role of ethics in your professional life and participate and promote resolution when ethical dilemmas develop. It also shows that by clarifying your own values, that will make you more effective when ethical dilemmas occur. Ethics are the study of conduct and character. Ethics are concerned with determining what is good or valuable for individuals and society at large. Bioethics is the study of ethics within the field of healthcare. An ethical dilemma is when it is unclear to the healthcare team or provider on what is the right thing to do. Values are personal beliefs about the worth of a given idea, attitude, custom, or object that set standards that influence behavior. So the difference between ethics and values. Values are personal. Ethics are interpersonal, between people, between groups. There are some words that we should, some vocabulary words coming up on the screen here. And the first is autonomy. And that is the commitment to include patients in decisions. So we've talked about that word before, and knowing that we know that nurses have a piece of autonomy in practice, but our patients also have autonomy to make decisions. Justice is being fair. Non-maleficence is avoidance of harm or hurt. Beneficence, taking positive actions to help others. And fidelity, which is keeping promises. Practitioners in healthcare delivery agree to a set of ethical principles that guide professional practice and decision-making. These principles are common to all professionals in healthcare, and they guide your commitment to advocacy, an important concept in caring for others. Autonomy refers to the commitment to include patients in decisions about all aspects of care as a way of acknowledging and protecting a patient's independence. Justice is used most often in discussions about access to healthcare resources, including the just distribution of resources. Beneficence is fundamental to the practice of nursing and medicine to take actions to help others. Maleficence refers to harm or hurt. Thus, non-maleficence is the avoidance of harm or hurt. In healthcare, the practice involves not only the will to do good, but an equal commitment to do no harm. And fidelity is referring to those agreements to keep promises and based on the virtue of caring. Responsibility refers to the performance of duties associated with a nurse's role, including characteristics of reliability and dependability. Accountability refers to the ability to answer for one's own actions. Competence ensures the provision of safe nursing care. Judgment refers to the ability to form an opinion or draw sound conclusions. Advocacy refers to the support of a particular cause. Confidentiality mandates protection of patients' personal health information. So up on the screen right now, I have the Code of Ethics for Nurses, and this is from the American Nurse Association. This document is actually quite long, and we're just going to go over the titles of the provisions. So there are 9 provisions. And Provision 1 is the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Provision 2, the nurse's primary commitment is to the patient, whether that patient is an individual, a family, a group, community, or population. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. Provision 4, the nurse has the authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to promote health and to provide optimal care. Provision 5, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. Provision 6. The nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. Provision 7. The nurse, in all roles and settings, advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Provision 8. The nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. Provision 9. The profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. There are some ethical theories out there, and we're going to talk about them just in general. And the really recognizing that ethics has grown into a complex field of study, more flexible than fixed, filled with differences of opinion and deeply meaningful efforts to understand human interaction. These philosophies or theories on ethics provide a foundation for developing strategies to use when an ethical dilemma occurs. So the first one, deontology, defines actions as right or wrong based on their right-making characteristics, such as fidelity to promises, truthfulness, and justice. Utilitarianism proposes that the value of something is determined by its usefulness. The greatest good for the greatest number of people is the guiding principle for determining right action in this system. Utilitarianism guides us to measure the effect or consequences that an act will have. Deontology, by comparison, focuses less on consequences and looks to the presence of pure principle. Feminist ethics looks to the nature of relationships to guide participants in making difficult decisions, especially relationships in which power is unequal or in which a point of view has become ignored or invisible. Feminist ethicists propose that the natural human urge to be influenced by relationships is a positive value. And then ethics of care suggests that healthcare workers will resolve ethical dilemmas by paying attention to relationships and stories of the participants and by the promotion of fundamental act of caring. We will do an exercise about that when we have class. So the question is, what do you do? What do you do when you come to an ethical dilemma and something you're not sure about? And we know that ethical dilemmas cause distress for patients and caregivers. Ethical dilemmas exist when the right thing to do is not clear or when members of the healthcare team cannot agree on what is right. Resolving an ethical dilemma is in many ways similar to the nursing process in that it requires a deliberate and systematic plan. A process for resolving ethical dilemmas that respects differences of opinion and all participants equally helps healthcare providers resolve conflict about right actions. And as far as legal issues go when it comes to ethical dilemmas, if you are able to talk through your process of thinking and coming to a decision of what's right or wrong, that will usually protect you for legal issues. And so this is what is going to help you right here. First of all, find out, is this an ethical dilemma? Make sure you gather all the relevant information from all the points of view, not just yours, but from all the points of view. Clarify the values, your values, the values of the facility and other care providers. Verbalize the problem. Identify possible courses of action, and there might be many. Negotiate a plan, and then do the action, and then evaluate the plan. The ability to clarify and express your own point of view will help you adhere to a professional code of ethics. Your point of view is shaped by your personal values. Values vary among people and change over time. Understanding your own values and acknowledging the values of others will help you resolve conflict during decision making. Once you clarify your own point of view, you can turn to the patient and begin to clarify your understanding of the patient's point of view. When ethical problems arise, a clear understanding of the patient's point of view will help you to speak for the patient even if your own point of view differs. When the situation concerns healthcare issues, personal habits, and quality of life, all participants in a discussion will benefit from clarity about personal values, along with a willingness to look beyond your own personal preferences for shared values. Your respect for the point of view of others, especially when it differs from your own, is a critical ingredient in the successful navigation of ethical deliberation.